of us know people or personally have had illness that has been very chronic, very severe, and managing it has been very tough. Sometimes how you manage these chronic diseases help it to either heal faster or later. Sometimes we think that, oh, once someone did a particular care on their diseases, we can adapt the same kind of care on our chronic disease. But sometimes our bodies are different. Today we want to look at how we can manage chronic diseases so that when you have it or you know someone who have it, you know the right information to give them so it can be handled appropriately. I am Martha Rains Price. Let's take a break. When we are back, we delve into more. Stay tuned. Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible, bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha Rains Price Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha Rains Price, every Thursday and Saturday at 8:30 p.m. on Truth TV, the Reflection Show, restoring hopes. Welcome back from the break. We are looking at management of chronic diseases. I'll be speaking with Madam Warrinyang Margaret. She's a palliative care nurse specialist at the Tamale Teaching Hospital, helping us to understand everything about chronic diseases. In fact, management of chronic diseases. Thank you for joining us once again.
Thank you for having me.
Yes, so straight to the point. When we talk about a chronic disease, what do we mean by chronic disease?
So chronic diseases are health conditions that will usually last for a very long time. You are going to live with the disease for, say, more than a year. Then we'll consider that condition as a chronic illness.
Okay.
Unlike, say, a disease like malaria, that's when you are infected with malaria, in the span of, say, a week
or 2
or less, you are cured of malaria. So those are acute diseases.
Okay.
But chronic disease has to take a longer time to manage it. And we are saying that at least you have it for a year or more.
Examples are what kind of diseases?
So chronic diseases, there are many. You can have the hypertension,
okay,
diabetes, sickle cell diseases, the cancers, the end-stage organ diseases, asthma,
okay,
and even some mental health conditions like
depression. Sickle cell a chronic
Yes,
disease.
sickle cell is a chronic disease, and even some mental health conditions like depression, where you have to, people are depressed for more than a year, and they need to be managed.
Okay.
So these are some examples of chronic diseases.
Okay. Are there some, maybe recently in the hospitals, are you encountering some very common chronic diseases?
So mostly the common ones that we see in our hospitals are the hypertensions, the diabetes, the cancers are also coming up.
And kidney?
Yes, end-stage kidney
yes,
diseases.
Yeah.
And then heart failures.
Ooh.
No. So these are non-communicable diseases, and of late the talk has been on, these conditions. So there's an upsurge of these conditions, and mostly also even affecting the youth.
Yeah, I'll just come in there. Are they usually older people or younger people?
So for me, growing up, we used to think that these diseases actually are for the aged, but it's no longer like that. It cuts across ages. You have the young, you have the old, suffering from all of these diseases.
Because when I was young, when I hear of kidney diseases, it used to be on TV, and you hear that if to prove your love for someone, you have to remove one of your kidneys, and maybe the guy will tell lies that he's down with kidney to try to test 2 girls, one of them that will give them. But now you hear of a lot of people just having kidney failures.
So mostly these chronic diseases, most are associated with what lifestyle.
Okay.
That is not to say that if you are living a certain lifestyle, you will get that disease.
Okay.
But it contributes
them,
to
yeah.
your chances of getting such diseases. And of course, of late, our lifestyles are different from old. The things we eat now, the things we wear on our bodies, even exercising. Now we are all entering cars and motorbikes. We don't do the usual walking again. So they all have effects in the long run.
Yeah.
And so they add up, these factors add up, and you can result in a chronic disease in future.
Okay. Now the lifestyle, I want to delve more a bit on that. You've mentioned, especially with kidneys, what are some of the or general lifestyles that you think that as we live, not just the eating and the walking, or that you see among we young people that can be a risk factor to contracting any of these, apart from things like sickle cell that of course is
genetic.
Yes, it's quite genetic, but other chronic diseases, even on the skin, you see people having skin chronic bleaching and all that. What are some of the lifestyle that can put us at risk to these chronic diseases?
So the main thing that will come to mind when you mention lifestyle changes usually is diet.
Okay.
Diet, and then sedentary lifestyle.
What is that?
So sedentary lifestyle, your life doesn't involve any physical activity. It's from sleeping to eating, sitting down. You hardly do any physical activity like exercising, consciously even exercising, taking a walk, stretching and all that. So when you mention lifestyle changes or lifestyle activities, these are the 2 main things that come to mind. Our diets, we no longer eat the vegetables, we no longer eat the fruits. We are mostly eating starchy foods, and non-balanced diets. Or we have the vegetables, but the way we prepare it, then it loses its quality and then its value.
Yeah.
So mostly you eat them, then the benefits you are supposed to get from them, you don't get it. And then junk food, one of the fast foods, foods that are easy to make.
Yeah.
And all of these sometimes don't really add up to the nutrition that our bodies needs. So they will, in a long run, go and affect the organs that are supposed to also be healthy to keep us. So your heart is supposed to function well, and now it's not getting sufficient nutrients. It will break down your liver, your kidney, and all other organs in the body. So diet actually plays a crucial role in health.
Okay.
Then we speak about exercise. So exercise also helps you to have free flow of your blood. Straightens maybe some stiffened joints and other things. So once you don't exercise also, then you are causing the body some injury, and in the long run it results in other conditions. You mentioned bleaching, or the things we apply on our skin. Of late we have an increase in skin cancer also. So really? All these can in a way contribute to you getting diseases such as that.
Yeah. Let's look at the medications that we take from the hospitals. Now, most of us have moved away a lot from the herbal medications, and how do you call those medications?
So alternative therapies.
Alternative therapies. Medications. Yeah. What role does it really play in managing chronic diseases?
Medicines, be them alternative therapies or hospital medications, play a crucial role in managing chronic illnesses. So you see that from my definition, I said that it's a disease that's going to last for a long time. So usually it's being managed, not cured.
Okay.
So they are managing the symptoms that are being presented. And so you'll be on medications for a very long time. They will have to be monitoring you to see the progress. Is the drug helping? Do they need to change it? What are even the side effects of the particular drug which you have to take for this long? So regular monitoring is key with chronic diseases. And like I said, whether it is alternative therapy or any other therapy, it's all geared towards managing the disease, but not curing the disease.
Okay. Now, there are people that you usually see who says they've gone to the hospital, they've given them these drugs. They get home and some grandmother B is giving them some herbal or whatever medications. Is it advisable to be using these medications at the same time in managing chronic?
This is a dicey one. So if you start your disease, say, with a doctor in the hospital, and you think that you want to try another form of therapy, these are discussions that you should have with your doctor, because the effects or the side effects of one could be affecting the other. So, but when you have this discussion with your primary physician, they are able to give you, appropriate advice. Otherwise, you might just be taking in another drug, and it will be a contradiction to what you are already having. But if you have a discussion, because these physicians, they have knowledge or little knowledge on these other therapies, so they'll be able to advise you. This one will not be so good with this. Okay, you can also try this other one, and then we see. So it's a matter of communicating and then getting the best.
Have you had situations or instances where people go against your medications?
Many times.
And they have effects because they tried other forms of medications?
Actually, there are testimonies of people, going against, say, hospital medication, taking to other alternative therapies, and it has worked for them. There are testimonies to it. There are also testimonies of people doing same, and it didn't work out for them. So that's why I said it's just good to have a discussion, so that you come out with the right or the appropriate, management, which will be helpful to the patient.
Like I said in my intro, our systems are different.
Exactly.
So I may have the same situation, use other medications, it will work for me, and you will use it, and that may not be able to work for you. Now, so the medications are supposed to reduce the symptoms, but not to stop it completely.
Yes, so like I said, as for chronic diseases, we manage them. They cannot be cured, or they may not be cured. So, and once you are managing something, it's an ongoing event. So as the symptoms come, then the medications are given to manage or reduce the severity of those symptoms. Also, the medications are given to prevent complications. So if you did not probably take a particular drug because, let's say, a nerve is being pressed on, then the blood supply there is also reduced to that area. But if you take a drug that can relieve the pressure on, say, that part, then the complication of, say, blood not going there is being stopped. Also, the medications are given to stop the progress of the disease. That is to say that once you have a chronic disease, it's going to go to the next level, and to the next level, and to the next level. But the drugs are kind of going to slow down that journey. So if a disease was supposed to kill you, say, in 3 years, taking the medications can prolong your life to 20 years to 50 years. So the drugs are for that purpose, to manage the symptoms that come up, to prolong to delay the progression of the disease, and also to prevent any complications that will arise.
Now let's look at the role healthcare providers can play. Is it just giving them the medications and that's all? But what more role can they play in helping people to manage these chronic diseases?
So healthcare providers, we play a key role, because if you have to live with your disease for a very long time, you will need education. The patient needs to be educated to appreciate that this is the condition, this is how it will play out. These medications are supposed to help stop this, reduce this, or prevent this from happening. So all of this education has to be given to the patient. So the patient understands his condition. I have diabetes, and I know that I should not keep on eating things with sugar, because the more I eat things with sugar, it will not help my sugar level.
Yeah.
And so it will aggravate the problem.
Yeah.
So if the patient appreciates his condition, then he's able to comply with the medications that you are giving, and also with the lifestyle changes. But if patient doesn't really appreciate the condition, you may just give the medications, the patient will not adhere to it.
Okay.
And so the reason for the medication will not be achieved, and then complications will result.
Like we those who fear medicine sometimes, and I think that everyone who do not like taking medications, who have been on malaria, thank God it's not a chronic disease. Once you take the first dose and you feel fine, most of us do not complete the 3 days medication of morning, evening. If you are lucky, maybe it's the first day you take the morning and the evening. The second day when you take the morning, and it works fast. The first dose, like for malaria, it works very fast. So the second day you can just take maybe one, only the morning or only the evening, or the third day you let it go. But let's look at how you've mentioned about how they accept the medication, so it's able to help them to appreciate it better and all that. Let's look at also the home. If my family member has a chronic disease, what role can I play as a daughter, as a sister, to help them to manage? So you maybe have come to the hospital, the patient has accepted their issue, the healthcare providers have done their best. When they get home, what should I do as a patient relative to help them to get better, or to help the management processes?
One of the management actually of chronic diseases is support. So someone has to live with a disease for a very long time. He will need every support, especially from family. So usually the education we give, we don't just give to the patient alone.
Okay.
Most of the times the family is involved in this education. So you educate the family to, they too should know what the disease is, be able to appreciate it, know how it is managed, what the side effects of the drugs should be, what to expect as they are taking the drug. The family will give support and even remind us, okay, today you have a review with the doctor. You are supposed to take your drug at 10 a.m. You are not supposed to take sugar. So if you don't
hide all the sugar in the house.
So if you don't get all this support from family and it is just you, it might be difficult. So family support is very, very key. And so we educate the family. If they also appreciate the disease, then they are able to offer help in that regard.
Our health systems in Ghana, are they equipped enough to help patients to manage their chronic diseases?
So it's a yes and it's a no. The yes will be yes. Once there is management options for a particular disease, so say diabetes, once we have management for it, there are drugs you take that will lower your sugar level. And these drugs are available and patient can afford, then we'll say yes. But if drugs are not available or patient cannot afford, say the drugs are not covered by health insurance, and of course patient cannot afford, then that becomes the problem. It means that you now know what you are suffering from, but you are not able to afford the treatment.
But there are some of the hospitals, let's even look at HIV. There are times that I'm told now it's free, the antiretroviral drugs are free, but sometimes they are not available. So even if you have the money, but the drugs are not available at the hospitals for you to purchase.
So that's a challenge, like I mentioned. So the availability of the drug. You know that you are supposed to take drug A, which will help, say, in your pain, but it's not available. You have the money to buy, but you can't get it to buy. So that will bring a toll on the management of your
So who
condition.
is to blame? Like to be blamed? The patient, the healthcare providers, or the government, or the health systems, if I may put all together?
I think we'll have to push it to the health system. Because the patient, like I said, if you have money to buy, so the patient is willing that this is the trend that I should follow to get my condition managed. So the patient is willing to change lifestyle, willing to buy drugs, willing to, come to the hospital for regular monitoring. But then the drug is not there to buy, so we can't blame the patient at that point. The healthcare providers, you may not blame them much. They have given you the outplay that let's do this and it will help. But then they are not available, and they are not the ones to be providing these things. So we have to push it then to, health systems and then governments that once these things are not available for people to work with, then it becomes a challenge in managing these conditions.
Because sometimes we see those who go for therapy, I think it's for those who have kidney and cancer, right? They go for therapy. Chemo like 2 times a week. Some have to go for chemo. Like, is it kidney or cancer? Sorry, I don't know.
So both are kidney disease, we're going for dialysis. Then
okay.
Cancer, they will go for chemo. Those taking chemo or radiation.
Okay. But sometimes they are so expensive. Recently, we heard that the National Health Insurance Authority has subsidized some of the prices, and also young people who are, is it 19 and below or something like that, are exempted. It's for free for them. And if you are 20 or 21 to 59 or something, you have to pay some amount of money. But it's still quite expensive because you have to go for dialysis like almost every week. Or
some people, depending on your results, your kidney test results, some even go twice a week.
Wow.
Twice a week.
I pray that we don't get to that point whereby all your salary just gets into your dialysis. Let's take a break. We'll be right back.
My name is Mohamed Samsi. I'm from Tinguri. Today we are at Beduri community with Martha Inspire Foundation and Plan Ghana. Today we learned a lot. We learned about menstrual hygiene. Then they taught us how to insect pad, how to remove pad, how to dispose the pad.
When you wear a sanitary pad, the long parts at the back prevent you from soiling the clothes you are wearing with blood, whether you have a heavy flow or a normal flow. So in an instance where the long one is in the front and the short one is at the back, you will end up soiling yourself. So when you open it, to the front parts, you have the short one. To the back parts, you have the long one.
We learn about how to change your pads when you are in your menstrual period. They taught us about how to speak in public and safeguarding. You need to protect yourself from harm. And some of the example of safeguarding is sex enforcement, allegation against staff, and grooming. And you've learned how to identify yourself. I want to say thank you to Plan Ghana, thank you to Martha Inspire Foundation. We are really grateful. Thank you.
So as the team says, maximizing your potentials, yes, you need to go through formal education to actually be fit for this work that you do. We might say that education is expensive now, but trust me, literally, illiteracy is more expensive.
My name is Marlene Egbedema, MNS. I work at the Tamale SDA Hospital, and I was very excited when we got here and saw that there were a lot of girls who came to learn from us, and the whole thing was very successful. I was very excited again when some of them actually listened and had questions to ask. Questions like when a girl is supposed to start her cycle, why some women don't have their menses, how long the menstrual cycle should last, and somebody asked me why they get their cycles twice in a month. And that shows that actually they came with a mindset to learn. All in all, it was a good time and it was exciting. I would like to thank Martha Inspires Foundation and Plan International for the opportunity. It was nice being here, so thank you to them.
My name is Mohamed Lambong. I'm from Buaini number 2, and then today we are here purposely for a Youth Empowerment Summit. What we've learned so far here, in fact, we are speechless because we can't just express it, because we've learned a lot since Martha Inspires Foundation with Plan Ghana started with us. We started, that was in the January time, up to now, and we've learned about teenage pregnancy, drug abuse, early marriage, and many things. And Martha Inspires Foundation have helped and supported the majority of us, and then we've gotten that opportunity to speak even on air, and then sometimes TV discussion, just as the team was in the summit, maximizing our potentials. Through this, we've been able to maximize many of our potentials. In fact, Martha Inspires Foundation, it has helped us a lot to add up the drug abuse side. With Martha Inspires Foundation, we've learned that there are some certain drugs that we are taking, and then in taking of those drugs, you do abuse them because you don't take them as what the doctor has been prescribed by us to do. What Martha Inspires Foundation have donated to us, and even just today they came with some donations. And then some of the participants of this program, in fact, they've enjoyed being in the program. And in fact, it's just amazing. Thank you, Martha Inspires Foundation. Thank you, Plan Ghana.
I want to thank Plan Ghana and Martha Inspires Foundation for your caring and your support. Thank you very much.
Welcome back from the break. We are looking at how we can manage chronic diseases. We have mentioned a number of them, a few of them. One of them that I really want to reiterate is skin bleaching. I don't know if you've seen some young women out there, even elderly women, sometimes their skin, you can't look at them twice. And even if you try to look at them, they feel that because they have that condition, you're trying to look at them to mock them or try to look at them to like maybe try to, be like, ew, that kind of thing. But sometimes some of them, it's dark, it's crazy. Even their bodies or their hands. And people are trying to correct the skin. Like, I believe maybe we'll do a different whole episode on skin bleaching and their effects and all that, yeah. But let's look at the misconceptions on chronic diseases.
So there will be many, but I'll mention a few. Some of the misconceptions people have about chronic disease, sometimes people think it's spiritual. So once you have a particular condition, then they think, you have been bewitched, or you have not lived a good life before, and so on. Others also think that having a chronic condition will be some punishment you are paying for. Your forefathers have done some sins, and then you are the one to pay for that. Then another misconception is people think that when you have these conditions, there is cure. Like I said, there's difference between a cure and then a treatment or management. Yeah. So once you get a chronic condition and you come to the hospital, sometimes you are buying drugs, you are doing tests, you know, the perception is that once you do this test or you buy that drug, you are going to be relieved of that condition. But no, it is to reduce this, you know, the severity of your symptoms and prevent, you know, complications. So these are some of the myths that people have about, you know, chronic conditions, thinking that is because you have not lived a good life, thinking that, you know, once you have it, there's a cure for it because you have come to the hospital, and so on and so forth. And like you rightly said, we are different. So another person has the same condition and it doesn't complicate.
Yeah.
You may have it and yours leads to another and then to another. So we are different and our adherence level is also different with the drugs.
Let's look at the future. What has the future got for maybe you are in medicine or in the medical field? Do you think that things are going to get better for people who have chronic diseases?
I think advocacy will have to come in, you know, advocating for, you know, people who are sick. Ideally, it should be free because no one buys sickness. And so if it is not something that I have really gone to acquire, you know, I wanted it and I went for it, then I should not really suffer when I have it. The nation should be able to absorb, you know, a percentage and make it flexible for people to really go through this whilst living their normal life, you know, improving their quality of life. So going forward, that is what, you know, as a nation, maybe we should be all preaching and advocating for. And I think of late, like you mentioned, that dialysis patients have been on the streets, you know, they've been on TVs, you know, asking for this, that they need some, you know, reduction in, you know, the fees. And I think all of us should join. Everybody should join because everybody is a potential patient.
Like, what makes it expensive? I'm sorry, I'm not in a medical field, so is it the machine? Because for those who have, is it kidney, right? Dialysis, it's like, I saw a video where it's like your blood comes out and goes back in. I don't know how they do it. I saw a video and I was like, so if this is coming out, it's like all comes out at once, cleans and go, but it looks like some are coming out and some are still inside. So I want those going back mix. But is it a machine or what makes it expensive? We are a country and the machine is not already bought. Where does the money go? Like, I believe the money goes to the government.
Well, I think those who are specialists in that will be able to speak to it. But of course, the machines are costly to acquire, and then the other gadgets and materials that are needed, the medicines that are used are also, I think, are also, you know, costly. And sometimes, like I said, these are not covered by health insurance. So if you have to buy them to use, then that cost will have to go to the patient. So I think that is why. So it's something, I think, bigger than just the health facilities. Because if they have to buy these things, certainly they have to keep on procuring them. And even if the machine should break down, maintenance and all that comes in.
So the after you have gone for the treatment and everything, when it gets better, because we are usually not so careful, it's like when it gets better, we stop taking the medications. It means that when they say take it 1 in the morning, every day for the rest of your life, you have to take it.
Yes.
You can't stop taking it.
Yes, so but that is why there is ongoing monitoring. You will have to be going back for monitoring.
But what if you get to a point that you are unable to buy more? What do you do?
So the complications will lead. Complications will come in. Because the drug was reducing a certain symptom, you know, controlling something. And now you are not able to get the drug. So it means that that particular symptom will aggravate. Yes. But as you take the drug, you need to be monitored. So you have regular visits, regular checkups, where you still sometimes they have to check, say, your BP. If you are a hypertensive patient, they have to monitor the BP and see, is it even going too low again? Or you are taking the drug and it's not helping the BP. So drugs can be changed. There can be options, you know, to all of this is just geared towards, making the patient's quality of life better. And then the patient should still be able to do his activities of daily living. So if I am a teacher and I have hypertension, that doesn't mean I shouldn't be able to teach again. So I take my drug, it controls my blood pressure, and I'm able to go to school and teach. I'm a nurse and I have diabetes. I should be able to take my insulin. My sugar levels are down, and so I'm fine, and I go to work and I work.
Have there been any new technology, whatever, in improving these, like managing some of these chronic diseases?
Yes, I see now we have a lot of apps on our phones.
Okay.
People can use their phones to monitor their blood pressures.
Okay.
They can monitor their sugar levels. We have gadgets and support groups. People are on WhatsApps with other people with same diseases. So they're able to share their experiences and learn from each other. So these, I think, are the few technologies that are helping us, manage chronic diseases or monitor progress of diseases.
Now, so I'm looking at people in very rural communities. What are some of the challenges you have with them?
So in the rural areas, if there isn't a clinic there, one of the challenges would be the continuous monitoring. So you are on the drugs, and then we are not able to know whether the drug is helping or not, because we have not monitored again to see. So that can be a challenge in a rural area where there isn't a clinic or a hospital. Also, if patient has to come from far to, say, urban area to be checked, because of monetary issues, may not come. They're not able to come, because sometimes the transport fare in itself might even be what you can just use to buy the drug. And so you transport yourself there, checked, and then you can't buy the drug. So that can also be a challenge in terms of distance.
The palliative health care specialists, what are you guys also doing about helping people to manage these chronic diseases?
So palliative care, managing of symptoms, mainly will educate the patient. We want the patient to understand that this is the disease you have. This is how it is going to progress. When you take drug A, it is supposed to do this, but this is the side effect of this drug. So patient gets to know exactly what to expect. Palliative care will allow the patient also to ask questions where there are doubts, to ask for the options. So we mentioned alternative therapy. Patient thinks that I don't want to take the hospital medications, but I want to try diet alone and see whether it will help. You tell the patient the advantages and the disadvantages. Then the patient makes that decision. And whilst the patient is on that decision, you still monitor, so that if it is going off board, you would have explained all that to the patient, such that even when the patient sees that it's going off board, he's able to identify and say, okay, this one is not helping, let me go back. But of course, there will be consequences. If you are coming back, maybe it has now progressed to the next stage, and then you are coming back. So you have to come back maybe and start again and then continue. So all that is made there for the patient to make.
But you only do that at the hospitals. It's people who may want to, let me say, hire a palliative health care nurse privately, as where the person can be able to help them, like that, their day-to-day checking of their medications and their health, right?
Yes, so for those who come to the hospital, we'll give this education. But of course, we can come to your home and still give the education. And of course, a platform like yours, like this, is also another avenue that people get to know that if I have a chronic disease, I can always ask questions. I can ask my doctor to know about, how my condition is going to be like. What are the options for me? What should I expect? What should I be doing? And all that. So managing your chronic disease actually should be a multidisciplinary approach. It's not one person that can take care of you. So many people have to come on board, because once you have the disease, it affects a lot of things in you. And so everybody's expertise is needed to improve your quality of life.
Okay, everybody's expertise is needed. Now, I want to look at I've already spoken more about the health systems, okay? But sometimes we feel or we say that the health professionals sometimes do not really pay attention to us. What can we insist on when we get to the hospital as a patient? We know that you're supposed to give us some basic care, but I've had situations where when I'm asking questions, they feel I'm asking so many questions. Is it wrong to ask so many questions?
It's not wrong to ask so many questions, but I think the challenge sometimes has to do with the number of patients, say, the healthcare provider has to see. In our setting, we know maybe one doctor is to more than 100 patients in a day. And so if one patient will be taking 2 hours, 3 hours, we only have 24 hours in the day, it means that others will not be seen. I want to believe that, I'm not conclusive, but I want to believe that maybe these are some of the situations.
But I don't think a patient will take up to 2 hours. Sometimes you just want to understand maybe basically what is wrong with you.
So it's the right of the patient to know what is wrong with you. And the healthcare provider has the duty to educate you.
Apart from that, some of you also don't like saying the truth, quote and unquote. You want to go by, even if it is looking bad, you're like, oh, we are on it, we are looking at it. Like, is it that there's a training they train you in medical school that you should not communicate the thing? You'll be using some big words, no, we don't understand.
So we are not supposed to use big words. We are supposed to use words that the patient will understand. So if I'm dealing with an illiterate, I should speak the language that the patient will understand. If I'm dealing with a literate, who will understand these things, then I can use them. So it's a duty of the healthcare provider, like I said, to be able to communicate to your patient such that the patient understands you. Yes. So of course, you have one or two of us, like I said, not doing the right thing, sometimes. But ideally, this is it.
Okay.
Going around the point, like we are saying, trying to make it look nice, is because sometimes maybe the individual wants to maintain hope. You don't want to just kill the person's hope like that. So if you are seeing a patient who is probably a very religious person, who believes and hopes that miracles still happen, you can't go a certain line with the patient. So you still want to maintain the patient's hope and then all that.
Okay. Give us your final words. I like what you said about miracles still happen, but sometimes, of course, miracles still really do happen where people are able to pray and then God is really able to intervene. But sometimes, so I think some of you also may have some, not all doctors, few may have a bit of wrong diagnosis as well, maybe, or not complete diagnosis. So maybe they also need more time to go through whatever tests they are doing to be sure before they communicate whatever that is wrong. But we are always in a hurry to hear whatever is going on. But your final words on maybe tidbits, maybe some bullet points we can take home on managing chronic diseases.
Yes, so to say that for chronic diseases, let's report early to the hospital when we see anything different from our normal in our bodies. Let's try to eat healthy. Let's exercise. And if we have been diagnosed of a chronic disease or we know someone with a chronic disease, we can just, give the person education as to where to even get, an overall education of their condition. That is, if we can't, offer them that education. And healthcare providers are always available to educate patients on what they want to know.
Okay, thank you so much for joining us on this episode. I have been speaking with Madame Margaret Bonya. This name, but she's a palliative care nurse specialist at the Tamale Teaching Hospital, helping us to understand that no matter what the disease is, there was a form or a way it can be managed so that your life can be prolonged. A big thank you to Twillium Industrial Company Limited for supporting us with some refreshment, Jingo and Juango. And also, you can get Jingo and Juango at all shops across the country. And then we also have Fruit Fusion here in Tamale. She'll be moving to Accra very soon. You can get in touch with Fruit Fusion on 055 047 6397, or you can easily get them on WhatsApp on 050 5499 499. They have a number of products. They have granolas. They also have cookies and smoothies. Get in touch with them for all your smoothie needs and small chops needs as well. I am Martha in Spice. Thanks for watching. Have a good night.
Growing up, it was so difficult finding answers to all the questions that bothered my young mind. As soon as I found my purpose and understood my mandate, I made it a mission to answer as many questions as possible bothering young people. I have mentored, inspired, and helped young people unearth their potentials through the Martha in Spice Foundation. However, I feel it is time to bring the conversation much closer to you. We have you in mind, you the young person. With my team of experts, we bring to you the Reflection Show, a show that focuses on addressing issues young people face, helping them to unearth their potentials, and giving them nothing but the best avenues in helping them solve issues that they may face in their young age. Join me, Martha in Spice, every Thursday and Saturday at 8:30 p.m. on Truth TV, the Reflection Show, restoring hopes.